Hi, my name is Tony from Advocate Home Care Products. I'm here to show you how to use the phototherapy unit. The machine comes in a nice bag. We have to set it up properly and probably in a child's room or wherever you want. It is movable, transportable. The important part is we're going to find a strong table, not higher than the child, to set it up away from carpets and blankets and close to an outlet. The machine comes in a nice carrying bag. Comes with the pad, and this is the machine itself. It's very important that when we plug this in, we don't use an extension cord. It is a 3-prong. The other end will match up with the back of the machine. And plugs in real good right in here. If the machine doesn't ever start up, always check back here because sometimes this can slide out. And we got it set up. This is the pad. This is a fiber optic pad, which means that there is no heat in this tubing, so you don't have to worry about heat for the baby. And this is the part here that will hook in the machine in a second. Also in the bag is some vest and some instructions and some tape. Okay, this pad is unique because it's actually called a wraparound, and it wraps around the baby. So it's kind of a loose wraparound, but it fits right around the baby. So the best thing to do on this is they're called pads, so what happens is it slides right through. And this pad, you're going to have the darker side and the lighter side. So we slide it through. This pad has writing on one side and the other side is the smooth side. So always remember to put the smooth side through the lighter side of the pad itself. We're going to go ahead and slide it on through. There. So you can still see the pad. We slide it all the way through. And then we're going to put the fiber optic cable into the machine. And you see this little latch right here. This actually lines up with this little part here. So we're going to slide it in like this. So this one actually turns and it stays in. But if it comes out, it's only going to come out at that time. So if you pull it out and you want to go to another area, like down into your living area, basically, when you shut the machine off, we have to wait 15 to 20 minutes before we turn it back on because the bulb gets really warm. But when you take it out, you can just turn this till it pops out here. Okay. Next thing to do is when we put it on the baby, we're going to lay the child. And like I said, it's a wraparound, so it may be a little difficult, but we're basically going to lay the child right under here. And remember, no chafing in this area, so you don't want to go too high, and be careful around the nipple line. So basically, you got a whole sheet of tape here. Plus, if this tape doesn't stick well, you can actually use regular tape because it goes right over the pad. I'm going to get the 2 tapes ready. We're going to wrap this around. You're going to tuck it. And then bring this up just like that. We'll readjust once we got it on. Tape it the long piece because they're long for a reason to hold it on. And then, so it doesn't get uncomfortable for the baby, we're just going to slide it back down like this. It's a very loose fit, so don't worry if it doesn't fit right up with the baby. You're not going to wear any clothes. This is going to go against the baby's body. They'll still have the diaper on. If you need to put anything, sometimes people put like an oversized shirt or something if they want to put on, or use a blanket to cover the baby. This is only basically going to be on for 3 to 5 days at the most, according to your doctor's orders. When bathing the baby, make sure you turn off the unit and remove the vest and wait 15 to 20 minutes before you turn it back on. So now that we got it set up on the baby, we're going to go ahead and turn it on. Now there's 2 power settings, power setting 1 and power setting 2. We keep it on power setting 1 unless doctor tells us to go to 2, depending on what the bilirubin level is. Then we're going to go ahead and turn it on. And this is how it's going to look on the child. There again, it's not really tight, but it's right there, and just make sure when it moves up it doesn't do the chafing or over the nipple line. You can feed the baby, you can move the baby around, just never no farther than the machine. And remember, there is no heat. This is a fiber optic cable. You never have to worry about any heat. All heat's in the machine itself. Pads are all replaceable. You get 6 to 12 pads and replace them when they get soiled. A lot of times when you're changing a diaper, or it's just like changing a t-shirt. When it gets dirty, just go ahead and change the pad. The 800 numbers on the machine, very easy for you to look at. Give us a call 24 hours a day. If you have any questions or any problems, we can help you. When you're done with the machine, and the doctor said you were done with the machine, he will fax us an order indicating you were done, and we will call you and send somebody out to pick up the machine.